Please welcome the panel to discuss an update, Gun Violence as a Public Health Crisis, moderated by Editor-in-Chief for Kaiser Health News, Elizabeth Rosenthal.
Hi, everyone, and thanks for coming to what I think is the most, if not one of the most important public health issues in the United States today, gun violence. I think you know who our panelists are, and they're going to be talking a bit more after I give an introduction. I have a personal interest in this, in that when I was a New York Times reporter covering the environment in like 2001, I went to San Pedro Sula in Honduras covering fish farming. And I wanted to get some Tylenol at night from the hotel, and they said, no, you can't do that here. There are too many guns, it's too dangerous. And it felt like, how do people exist in this alien world? It seemed unfathomable to me in 2001, and now 20 years later, I feel like that's kind of where we are in the US. And at that time, I wouldn't have said, oh, this is a public health issue. I would have said this is a violence issue or a gun issue or something else. Now, you know, during the pandemic, I think the statistic is 10 times more young people died of gunshot wounds than of COVID. So I think it's gotten to, you know, we're in what is to me now, and I think to many in the audience, an unbelievable place. So to start us off, I've asked Chris to kind of give us what you know, we call kind of headwinds and tailwinds. What are the good things that we see happening, and what are the things that are holding us back? In my newsroom, we call them petals and thorns talks, where we talk about the pros and the cons. So Chris, can you take a couple of minutes to tell us where we are?
Absolutely. Thanks everyone for joining us today. I'm Chris Brown. I'm the president of Brady United Against Gun Violence. We're the nation's oldest gun violence prevention organization, obviously founded by Jim and Sarah Brady. Jim Brady was President Ronald Reagan's press secretary. He was shot, operated on at GW, and survived, but with some severe limitations. But he and his wife, Sarah, dedicated the rest of their lives to the passage of the Brady Law. That law has now been in effect for going on 30 years and has stopped more than 4 million sales of guns to prohibited purchasers across the country. That's a huge part of our legacy, and I think it's very, very important to understand that every single day in this country, that law ensures that federally licensed firearms dealers conduct background checks, which on average take less than a few seconds to complete. That's a success story, as is much of what we've seen happen in the last year at the federal level, including passage of the bipartisan Safer Communities Act that was just signed into law by President Joe Biden. That sets a standard that's quite important for funding of extreme risk protection orders across this country. 19 states and the District of Columbia, most recently my own state of Virginia, passed extreme risk protection laws, and those laws allow for the removal of a firearm from an individual who's at risk. The thing about those laws is they're only as good, and this is true for gun violence prevention overall, they're only as good as the knowledge of those who are in a position to seek a protection order. And so what the Bipartisan Safer Communities Act did is provide millions and millions and millions of dollars to states across this country who've enacted extreme risk laws for training of medical professionals, training of law enforcement, and training of the public in general to understand that if you have someone who's at risk in your home and you have access in your home to a loaded, unsecured weapon, that you have options to take with respect to that. Across this country, we have seen the states be strong and positive incubators for change in a number of areas. The extreme risk laws are an example of that. In California, there are background checks on ammunition sales. It's the only state in the country right now that does that. There is a federal law or federal bill pending to do similar kinds of good in that way. And finally, after 20 years of zero funding from the CDC and NIH in gun violence prevention research, we have been able to secure $25 million a year over the last 3 years for the CDC and NIH to research gun violence as a public health epidemic. So those are the roses, and they're substantial. And the reason why that's happened from our perspective is you can't live in America today without being impacted directly or indirectly by gun violence. I see a lot of you shaking your head and acknowledging that. Many Americans in poll after poll after poll are saying they want more protections for public safety in place, and they don't think that the Second Amendment can or should be read as a death sentence to our fellow Americans. And so we have election cycles in 2018, 2020, 2022, where a record number of candidates ran and won on a gun violence prevention platform. And those numbers are increasing every single year. Part of that, when you look at the polling data, and if you're a nerd like me, you love to look at the polling data, you'll see that younger millennials and Gen Z are very focused on this issue when they go to the ballot box. And politicians are paying attention to that. That's why the Bipartisan Safer Communities Act actually passed with 12 Republicans voting yes for it. That would have been unthinkable more than a year ago. The main headwind that we have is the Supreme Court of the United States. We just had a decision that was rendered, it's called Bruin. That case at issue was New York's 109-year-old permitting system that was administered to determine when individuals could or could not carry a concealed weapon in public. And the Supreme Court overturned that permitting system. So the current composition of the court is hostile, quite frankly. The majority is hostile to a balancing between Second Amendment rights and public safety, if you read that decision. So Brady, we have a legal arm, is very, very focused on protecting and preserving these laws as much as possible. After the Bruin decision, we worked with Kathy Hochul, the governor of New York, to pass a new permitting system for the state that would respond to, and we believe, hold constitutional muster with this current decision. But we have to continue to raise our voices, and we have to focus on this issue for what it is, a public health epidemic. And I'll just close by saying it is now gun violence in this country, the #1 killer of children, 19 or under. It surpasses automobile fatalities. It surpasses any other kind of fatality. We don't have to live this way, and we don't have to die this way. And so we're very focused on thinking about this issue as a public health epidemic, tackling it like we did secondhand smoke, drunken driving, seatbelts, really talking to people and educating them about whether they want to bring a gun into their home, and certainly if they choose to, why safe storage, why ending family fire in their home, that's our campaign, is so key. And so I'll close there.
Well, thanks for giving us a great intro to where we are and the progress that's been made. I'm going to ask our other two panelists to do some of the, and yet, with what have we seen in the last 2 years during the pandemic when it comes to gun violence. There are a lot of good ideas out there. There's good legislation, and yet, Brock, do you want to take?
Yeah, I'm happy
from
to
there?
start that. Sure. My name is Bob Axelrani. I am the Chief of Trauma Surgery at George Washington University Hospital. I'm also the Chairman of the American College of Surgeons Committee on Trauma for Washington, D.C. So what we really saw with the onset of the COVID-19 pandemic is a truly tragic story in regards to firearm injuries. As the pandemic was setting in early 2020, many of you may recall that there was very loud messaging put out by various pro-gun groups, more specifically the NRA, that essentially said, this pandemic is going to take over everything, we're all going to have problems with our finances, jobs, and thus our safety, so the best thing you can do is go out and buy a lot of weapons and protect yourself. And sure enough, as Chris will know far better than I, the sheer number of permit requests just skyrocketed. Well, when you flood the market with that degree of weapons, and then it's just a matter of time before you, on the physician side, on the hospital side, see the ramifications of that. And so what became true, and these were reports that were started getting published in all the major cities, including Washington, D.C., reports from Philadelphia, reports from Chicago, our own report here in Washington, where all the hospitals looked at, asked, what's going on? We found a near tripling of the incidence of firearm-related injuries over the course of just 1 year. So we went, at George Washington, my own hospital, from about a 10 to 12% of our victims of injury, of our patients, were injured by firearms. Went from 10 to 12% to about 35% in 1 year. That number has not come down very much. Today, as we sit and speak to each other, we are sitting at around 24 to 25%. We will never go back to 12% because the market was flooded with guns. Interestingly, we then asked the question, well, what type of phenomenon is this? Is this a urban, suburban, rural phenomenon? And it really is an urban phenomenon. We found that this was very true within the District of Columbia, much less true in the suburbs of the District of Columbia, and really not true at all in the rural communities. So as the market got flooded, it was the cities that took the biggest hit, and it was homicide in particular, much more so than suicide, that went up. And that will be one of, unfortunately, the longest lasting negative consequences of the COVID-19 pandemic.
And this is shocking to me because when I was a medical student in 1985, I did 2 months in the GW emergency room. I don't recall a single gunshot wound then.
Yeah.
You know, Georges, do you want to give us a little bit of you've been thinking about this for a very long time. How do things, do you feel like compared to 2-3 years ago, we're going in the right direction or the wrong direction? The right direction legislatively, but hey, how do we actually make a difference in these kinds of homicide, suicide rates that we're seeing now?
Yeah, so I'm Georges Benjamin at the American Public Health Association. I'm actually an internist and an emergency physician. And in 1990, I found myself as a health commissioner in Washington, D.C. And some of you may remember in D.C., we were known as the murder capital of America. We had 5 major trauma centers. And those 5 major trauma centers were all busy with gunshot wounds. And we have less trauma centers in the city, but it's gotten worse. And it's gotten worse nationally. You know, my first review is that we always talk about what is a public health problem. Well, if it hurts people or kills people, it's a public health problem. It also is preventable. And I think the real challenge we have here is that the lack of political will, not only just amongst the resource allocators and the policymakers, but among the general public. A lot of mistaken understandings about a gun being protective when it is not necessarily protective in many situations. Way too many guns, and more importantly, way too many guns in the hands of the wrong people. And even those tools that we have, like the Brady Bill, I was with Jim and Sarah when the bill was passed back then, and I've been a strong supporter of it. And it works. And making sure that you identify people who are at high risk is important. just to remind you that 60% of the people who die from firearms are people who are killing themselves, suicides. Suicide is an an act that you do suddenly. It's an impulse act. And they may not do it 15 minutes later or 30 minutes later. They're upset, there's a concern, the firearm is there, they use it. And as an emergency physician, there are a lot of things that we can do in emergency departments to put you back together if you crash your Chevy. In general, a gunshot wound used to try to kill yourself is not one of them. Increasingly, people are carrying firearms and using them because someone else has a firearm, therefore they feel they must have a firearm, particularly in our inner cities. Just this whole idea of carrying firearms. And as you know, the law is going in absolutely the wrong direction. We're having more and more permissiveness around firearms in just some of the most bizarre places. Youth and alcohol and bars and parties. There are many things that ought not be in those places, but guns is absolutely one of them. There's no reason to have a firearm in church. There's no reason to have a firearm in school. And yet, this whole debate about what the balance is between individual rights and public safety is truly gone out of balance. Now, for full disclosure, my association was very much involved in the Heller decision. We think that was where, in many ways, the court began to go off the rails. Yeah. Made a sudden differentiation between the well-regulated militia and the rights of individuals. That was a decision of the court which fundamentally changed where we think about the Second Amendment. Mm-hmm. And I think it was wrongly decided. I still think it was wrongly decided. Nonetheless, that's the framework we have to work on. I would just say that in closing, that there's many policies we know work, right? We know that licensing works. We know that criminal background checks work. We know that risk protection laws work. We know that even getting to communities to get rid of urban blight makes a big difference. We know that once you have someone who's in the hospital setting who's been injured with a firearm, particularly if it's been in a violent encounter, that engaging that individual, engaging the people around them can reduce the violence. We know that reducing weapon carrying makes a big difference. More importantly, we know that, like anything else, asking the right questions, doing the research, using that research to define very clear, narrowly tailored policy manifestations can make a big difference. So the nation's capacity now to do the research needs to continue to grow. $25 million was great, but if you're really serious about doing something that's killing more youth under 19 than automobiles, it's going to require a multi-million-dollar research endeavor and a lot of sociological research that's going to be necessary to do that.
And can I ask the three of you, because we kind of know what works, right? There's stopping the impulsivity. One of the articles I remember most was terribly tragic. It relates to the suicide issue. I wrote at the Times, was about a young man who was in grad school in Oregon. His family in Texas, or in Santa Fe, didn't know he was depressed, or he wasn't particularly depressed, but had trouble with something that no one understood, a girlfriend fight, basically went out, bought a gun, shot himself in the head within 15 minutes, you know. And also the youth-on-youth homicide. These are impulsive acts often, right? They're not well thought out. The other guy has a gun, I have a gun, we're arguing over who knows what, and the answer is a gun. How do we change that? I mean, how do we, given that the Supreme Court has said what it said, what are we going to do? And you look at like the Colorado Springs issue, there are good red flag laws there, but they're not enforced, right? So we know what works, it's just that we don't I mean, at least we know some of the answer, but we don't even do that. Any thoughts?
Well, I think
you
where I
know,
would
talk
start
among
is-
yourselves too.
Where I would start is with the incorrect, factually incorrect messaging that's gone out around suicide, and I think around homicide also in regards to mental illness. Hear it from me. I'm the guy who takes care of the patients. They're my patients. These people are not mentally ill.
Yeah.
And I'm talking about the assailants. They're not. They're not bipolar. They're not schizophrenic. And so the messaging that if we just simply address mental illness, gun violence will go away is factually incorrect.
Yeah.
That's one. That's really important. The
And
second,
that's always brought up by
Always.
gun advocates as
constant.
the
It's
answer.
constant.
Oh, the answer is, you know,
the
better
second thing
mental
messaging
health
that
care.
goes on around suicide is, well, these people want to kill themselves, so if you get rid of the guns, they'll kill themselves by some other means. That has been disproven again and again in very, very well done psychological studies where they compare groups and they compare access to firearm-related injuries, and they can very easily demonstrate that if you do not have access to a gun, the odds of you killing yourself drop precipitously.
Right.
And so those are two incorrect messages that are put out there that basically say, well, it's going to happen anyway, and to some degree they're mentally ill, so we should address that. It's not the gun. It is the gun. And that's where we, I think, come in, by we I mean the physician side, to try to dispel some of these incorrect tales that are being told.
I think that's so important, and I just want to acknowledge all of the work that, for example, APHA has done to really try to ensure that physicians and the American Academy of Pediatrics also has a requirement. It's not always followed by pediatricians that at every well visit that parents bring their child into, the physician talks to the parents about whether there's a gun in the home, and if there is, safe storage is supposed to be part of that message. I think it's really what Dr. Sarani is saying can't really be overestimated, because in our society today, there's this persistent myth that's based on these belief patterns that anyone intent on completing a suicide, for example, will do so. That means don't matter. But 9 times out of 10, on average, 90% of the time, someone attempting suicide with a firearm will complete that suicide and they will die. That's compared to all other methods pursuant to which someone could choose to try to end their life. And the average completion rate is 3% or less. So you are taking something that is often, the literature says this, a rash decision, and you are making it permanent for yourself if you have a loaded weapon that's easily accessible. Imagine if all Americans knew that and understood that. It would be really huge, because what that implies is safely store the guns. And what that means is unloaded, locked, ammunition locked separately. I mean, that's the most ideal frame that you can have. And it's not just suicide, because 9 kids a day in this country are killed or injured with a loaded gun in their own homes. And 75% of school shooters get their gun from an unsecured home location. So think about the panoply of the kinds of violence we're talking about, and we're talking about 64% of gun deaths that we could, with that simple act, without an act of Congress, without any additional enforcement, make that happen. But we have to propagate discussions between and among ourselves, between gun owners and non-gun owners, about the presence of guns in homes. We have to do that. One other point on the homicide piece, which I think is really important, especially for all of you who are involved in healthcare systems and understand how you tackle other public health issues like the opioid crisis. There's a demand side problem in public health, and there's a supply side problem. There's always a demand and supply side, right? When we talk about gun violence, the reason in many of these communities, to Dr. Benjamin's point, that you will have people out, younger kids, getting firearms is because they have the belief everyone else has one. And then if they're carrying a loaded firearm, they're much more likely to use it, and not successfully, often used against them. Why is this happening? Most of that supply originates from federally licensed firearm dealers. 5% of those dealers, and we have more gun dealers in this country than McDonald's and Starbucks combined. Just think about that. 5% of them are responsible for the sale of 90% of guns recovered in crime all across this country. But the NRA, through backroom deals, has stopped the ATF, the Bureau of Alcohol, Tobacco, and Firearms, from telling all of you which dealers those are. So Brady has had to sue them. And we publish that information, and we help law enforcement target which ones they are. If we can have a more effective strategy to focus on those dealers and shut them down or reform them, we can have a material impact on the supply side, and we will save lives. Those are the kinds of things that also we need to be focusing on as we move forward.
Yeah, and how about the ease of purchase? Yes, bravo. I'm going to go look at that list,
Yeah.
but the ease of purchase is stunning. And in fact, the young man I was referring to who committed suicide, his dad is a physician, and the reason he wanted to talk about it was just how could my son, who'd never held a gun in his life, go out to a store, buy a gun in 15 minutes and come home. And if he'd woken up the next morning and heard the birds singing, he would not be dead now.
Well, it's not just obviously the ease of going to get a handgun,
Right.
but it's even the ease of getting an automatic weapon. We haven't even equalized the age in which you can buy
Yeah.
an automatic weapon. And I think the challenge is the technology of today is very different than when the Second Amendment was passed, right?
Yes.
You had the stop.
Confirmed.
You had to you had to load powder in, then you had to put the projectile in. You had to shove it down the barrel, and then you had to aim and hope that when it fired, it actually fired and went where it was supposed to go. And then when they died, they often died not from the projectile, but from the sepsis and infection that occurred later. And now, within a matter of milliseconds, you can fire a weapon and just kill 10, 20 people at a time, as long as you've got enough bullets in the clip. And so high capacity weapons with multiple rounds is a real problem.
Yeah.
And the fact that we have so many young people that can get access to this very easily, in fact, anybody. And then you have to ask yourself, just from a sporting perspective, is that really a good way to shoot deer? Which is often the argument.
Well, I mean, the answer is obvious to that if you need an AR-15 to shoot deer, you shouldn't.
The whole argument, the whole rationale for why you need a weapon and why you need to do this and why it doesn't make any sense at all. Yeah. Look, I grew up in Chicago. I know guns. I was in the military. I fired a weapon. When I was in ROTC, look, we had a rifle range, even though it was closed. We drilled with weapons. I was very comfortable with weapons, but you have to. They're a dangerous tool. They require a lot of respect. They require to be protected and put away safely with safe storage, and the rationale that you have to be able to get to your weapon very quickly if someone breaks into your house. Well, we probably ought to study it because the evidence is not that a good guy with a gun is going to be, outweigh a bad guy with a gun. The evidence isn't there for that. Now, if the evidence turns out to be true, then let's deal with that in a constructive way. But that's not the evidence that we see.
Can you all talk about from a public health perspective, the societal trauma on children of growing up in a culture like this?
Yeah, I'm glad you brought that up. Actually, that was exactly what I was going to comment on. I think from a public health or societal perspective, we've been talking thus far about the victim, him or herself, the person who is shot and dies. But let's talk about, for a moment, the person who is shot and does not die. And then let's talk about everyone involved in that entire scenario of caring for someone who has been shot, whether the individual does or doesn't die.
Or the kid who is just knows that the next school district over.
And so,
You know.
right, I'm going to tell you a story, and this is a story of a 15-year-old who, now 19, who just died the weekend after Thanksgiving. His story is all over the Washington Post and in the local news media, so it would take you very little effort to identify who I'm talking about. He was my patient. So he was 15 years old here in Washington, D.C. He was shot. Gunshot wound went through his heart, went through his liver, went through his stomach. Came into George Washington. He cardiac arrested 3 times. 3 times his heart simply stopped beating because it had a hole in it. 3 times we were able to rescue him back until he finally survived. And he survived to the point where he actually left the hospital perfectly intact, went back to school. We gave a lot of resources to this young child, knowing full well that he was in a pretty bad situation. And I must admit that this government really did give a lot of resources. But he knew the environment in which he lived. And I will tell you today, I saw him for years thereafter. He was shot 3 more times. On the 4th shooting is when he died. And that was the weekend after Thanksgiving, about 4 years later. So he was shot pretty much every year thereafter. He would come to my office and he would cry. He would cry in ways that you cannot imagine, tears coming down. The last time I saw him was as COVID had set in, and we were wearing masks, and his mask became wet. Because he knew his days were limited. Even though we tried, we said, you should move to Philadelphia, you have family there, we should do this, we'll put you in a job, we'll make sure your education is done, the government will give you money to finish off things that you need to take care of. He was not in a position to avail himself of those opportunities, right? Nothing changes when you survive a gun violence. You go back to the same neighborhood, the same community, the same peer group, the same everything. And so 4 years later, his own destiny was fulfilled in the sense that he died. So he dies, his family, of course, the second victims, his mom and dad, devastated. That goes without saying. People came up to me and said, well, you know, you heard that your patient died. I said, yes, I saw that in the news. And they said, how do you feel? And I said, well, number one, I'm incredibly saddened. This kid kind of worked his way into my heart a little bit. But I can't say I'm surprised, right? And that makes me even sadder still. Yeah. That's one. When these patients come to the hospital and they die, let me tell you, the nurses take it very, very personally. A nurse and a doctor are 2 very different people. Doctors come and go, they treat you, they go make rounds, they come back. We're a little bit aloof, I understand that. Nurses are not like that. Nurses are with you for 12 hours a day, every single day. They stand vigil by your bedside. And so if we're going to talk about public health, we need to talk about our public health system. We are breaking the backs of our healthcare providers, specifically speaking the nurses. The COVID-19 pandemic, the exposure to unmitigated risks, 12 hours in a room with a patient who's dying of COVID. You yourself may take that home to your family. The ramifications therein, watching these people die. And now we add on top of that, young person injured, dead. Young person injured, psychological turmoil, i.e. Post-traumatic stress. It's the second victims that are, I don't want to say the healthcare people are the victims. We're not. The victim is the patient. But there is a piper to pay. There's a price to pay as a society because we allow this ongoing, to Dr. Benjamin's point, preventable pandemic of gun violence. And it's breaking the backs of everybody. So we talk about the patient, but think about the second victims as well. That'd be everybody involved. And the ramifications on the healthcare system in total.
Elizabeth, you pointed out the fact that, you know, you were told not to go out because there were too many guns.
Yeah.
Well, imagine the fact that far too many of our communities, no one's going to go outside. They won't go out to play. They're afraid to go to school. Back in 1990, when we were having the drive-by shootings in this town, kids were afraid to be together on a corner because they were very likely to be shot. There was just so many drive-by shootings. I was doing the crack cocaine wars. The good news is we got our hands around that eventually, but it was fully traumatic. Not just the loss of, within the family structure, but whole communities were just totally paralyzed with fear, increased stress, which ultimately results in a whole range of, sociological issues, physical issues, increased blood pressure, higher infant mortality rates. I mean, there are a whole lot of secondary and tertiary public health complications from just the violence and stress in these communities.
And now that they're flooded with guns, the great increase in guns, how does that, you got a handle on it that time. This time, there are a whole lot more guns out there. And do people, One of the hardest stories that I read that we wrote this year was about in East St. Louis, where at preschool they were teaching kids where to hide if they heard gunshots. You know, what does that do to a generation of Americans?
It's called the lockdown generation, and that's part of why some researchers have speculated that that younger generation in particular, and I have an 18 and 21-year-old who fit into that category, are so focused on this issue because we're really traumatizing our own children, telling them that the solution to gun violence is to run, hide, or fight, worst case scenario. And they know that there's not a lot of hope for them if someone comes along with an assault-style weapon. And these kids are hearing on the news, even with parents who are really trying to monitor content, you can't go very far in our country over a year without seeing information about mass shootings, and they're internalizing this. We deal with a number of medical professionals who are therapists whose patient base are young kids, teenagers coming in to try through talk therapy and medication to deal with the anxiety that they feel about being shot. Many of them at school, others of them walking down the street in their neighborhoods. And because a lot of the research until recently had been zeroed out, now we're getting more research, and we understand that this kind of trauma is even passed down in utero to unborn children and impacts their ability to handle stress, to be resilient. And to Dr. Serrani's point, the thing that for me, I think really gets me upset and gets me up every day is that it is preventable. And I don't understand how any of us can claim to live in a country that respects life, liberty, the pursuit of happiness when we are conscripting our children to live and die in this way. To me, it's a very fundamental issue and a fixable one if we continue to understand the right kinds of solutions, which are frankly right before us.
Right.
It's not complicated.
Right, and this is where I think, and probably, you know, my parent organization, the Kaiser Family Foundation, we're nonpartisan and blah, blah, blah. And I shouldn't say this because I'm supposed to be even-handed, but this is one issue where I feel like it's the gun stupid, you know, it is,
Yeah.
and how are we
Yes.
going to deal with that? So,
Well, it's the guns, and it's not. There's no silver bullet. So what often
Right.
happens when something happens is, someone says, "Well, that one solution wouldn't have fixed it."
yeah,
Right.
Well, we know that when we looked at automobile crashes many years ago, it was a multi-sectorial, multi-solution effect that brought down automobile death and injury over time. And this is going to require a similar multi-sectorial,
Right.
multi-focused, multiple policy approach to addressing it. But we've got to start
Yeah.
by stopping the fear-mongering that happens every time someone decides they want to do something. And by the way, the problem, in addition to the fact that more guns get on the street, et cetera, is that the motive is money, okay? Because that's what they're doing. They're making more money. This is a marketing strategy. And the idea is you get more people out there with guns, then more people theoretically would support guns, will make more money. We've seen that in other industries. You know, the tobacco industry has a similar strategy.
right.
You know, to get people to just flood the market with their product. You know, the firearm industry has learned a lot from the marketing strategies. And the younger and younger you can get your customers to buy your product,
And they're addicted for life, right?
they're addicted for life.
Yeah. So what do we think we can do? Do you think it's going to start at the city level, the state level? I mean, you know, the seatbelt laws, smoking bans, you know, they didn't start nationally. They started
Well, we have to start locally, but also I think one of the things we have to do is some structural things. Number one, we have to stop state level preemption.
Yeah.
Because we have a lot of times where we have at the state level where legislatures or governors are prohibiting local communities from protecting themselves. That needs to stop.
And how do they do that?
Well, they pass laws that say you can't pass a law that prohibits carrying guns in a community, or they inhibit and tie the hands of the local elected officials or the school boards often.
Yeah.
In addition to appointing people that have their ideology on those policy-making entities. I mean, they have the right to appoint who they want on there, but I think we have to recognize as we're voting for folks, we have to put this on our list of things to be concerned about. And we need to make sure that we give local communities the capacity to protect themselves through policy. You know, as an ER doc, I often say that, you know, if someone comes in with a rat bite, it's great to take care of the rat bite, but if two people come in with rat bites, you got to get rid of the rats. And same thing with this. This is something that policy can make an enormous difference. If we want to spend all of our time trying to address one, you know, firearm-related entity and another firearm-related entity and another firearm-related entity, I guess we can do it, but it's going to take a lot of resources and a lot of time. We know that there are policies that work that have broad effects, and more importantly, the public supports it.
Right.
Yeah.
You know, it's the policymakers that aren't falling in line.
Right. No, I think this is, you know, this is shocking that and how popular this is in the polls, and why doesn't that translate into policy? And also, you know, we had the recent midterms. It wasn't issues number 1, 2, or 3. It was maybe in the younger generations, and this is what I want to know. Does it rise up above, you know, gas prices or, you know?
For Gen Z and younger millennials, it's a top 3 or 4 issue from the polling that we saw just in the last midterms that's come out. It falls down. It's still top 5, top 6, top 7 for older voters. It's not that it just goes away, but the priority placed on candidates that are gun violence prevention champions by younger millennials and Gen Z outstrips significantly sort of older Americans. And so those trends, we see those continuing because gun violence is not going away. And I just want to add one point to that. Doesn't mean that laws don't work. And to Dr. Benjamin's point, I think it's so important. You can't look at a single shooting and look at the factors related to that shooting and say, well, this particular law would not have prevented that. Because that's not figuring out, you know, automobiles, right, and fatalities when we didn't have seatbelts and other things. We didn't say, what's the one thing that we can do to make automobiles safer? We said, what is everything that we can do? And that was speed limits, that was bumper rails, that was airbags, that was seatbelts. All of those laws were passed, and then funding was put in to implement those laws, and we changed the social norms. There's something called the Brady Bunch effect. I remember this because I'm of that generation. Some of you may remember this too, when either Jan or Greg hectored the parents to wear seatbelts, and it was over 4 or 5 episodes of the Brady Bunch, and I remember, because I was highly susceptible to such marketing, I guess, telling my father, you need to wear your seatbelt, and admonishing him, and it turns out that was planted by folks at NHTSA, because even though younger folks were buckling up, because we were taught that in school, our parents weren't doing that so much because they had not been raised wearing seatbelts. So they figured out, have the kids be the messengers. And you know what? That saved a ton of lives. So it's not just policy. We need more policy. We know the policy that works. It's not just enforcement. It's also social norm change. And we have to depict and show the consequences of our failure to safely store guns in the right kinds of contexts to make this change away from the good guy with a gun myth that still remains persistent and is categorically untrue. So I think all of those things need to happen.
Can I ask?
Firearm injuries are, we have a lot more firearm injuries than just the deaths.
Right.
We focus like a laser on the deaths.
Right.
And a lot of those injuries are unintentional because of the faulty construction of the firearm.
Right.
Now, can I ask, Babak, because you had, from where you sit, so younger people are both more opposed to firearms as a political issue, but they're also more frequently victims.
Yes.
So how do you, are they different sets of young people? Can that force, as we look 10 years into the future, say, the kid who was shot is going to say to his parent, no guns,
Well, I certainly hope so. I think as Chris mentioned, this is going to be a culture shift, and I do think that physicians have a huge role to play. It's no different than, likening back to my parents who used to smoke cigarettes all the time.
I flushed a lot of cigarette packs down the toilet.
There you go. But the messaging time and again from the medical community, as well as others, but I think on this one, the doctors to some degree led the show, was smoking is bad. And this concept of the Marlboro Man as the ultimate macho person, or Joe Cool, those have now gone. Those marketing strategies simply don't work in the United States. And I think it's going to take an equally long period of time, perhaps longer, but for the physicians to say, having a firearm in your home increases your chances of unintentional death, inclusive of your own children, who may access the weapon, or you may shoot them because they're trying to sneak out of the house at nighttime, because that's what children do. That's what teenagers do. So I think we have a role to play, but it's going to take a very, very long time. And they're not two disparate groups of young people. They're the same group of young people who do believe that they are invincible, who really do take the marketing that we give them and swallow it hook, line, and sinker. We then need to kind of step up over time and say, you guys, they're trying to sell you a bridge. This is not the way it is.
And can I ask all of you, the Australian model of we're just going to, guns off, this bad things happen, we're just going to get guns out of society. I assume that's we're so far down the road that's not even a pipe dream.
Version of the Second Amendment. I agree with Dr. Benjamin. I mean, just historically, just to be clear, when the Second Amendment was ratified, you had muskets, which were very, very different than the kinds of weapons that we have today. And we hear stories about the Wild West and what that was like. And for those of us who, again, giving you a window into my childhood, my father liked spaghetti westerns, so we used to watch them, and I would think everyone had a gun. They were gunslingers in the Wild West. In truth, in most of those places, you had to check your firearm at the city limit. You couldn't bring it in because it was viewed as not mixing well with things like alcohol. I mean, we have a rich history, even when the Second Amendment was ratified, of inspecting how muskets and firearms were stored in colonies across the United States. So the idea that the Second Amendment provides an individual right to carry a gun anywhere for any reason is completely anathema to the history, context, and origin of our Second Amendment. And all of us need to lift up our voices, because Heller and then Bruen, for the first time ever in law, established a quote-unquote individual right to carry firearms. And the courts are looking at those decisions now and trying to understand what that means. What that means in its most extreme form, and we're fighting this wherever we can in court, is that no public safety law withstands that kind of scrutiny. We can't live in that kind of world, because truly then, it is a guns everywhere kind of approach. And we know too that the kinds of laws that we're talking about here have proven hugely successful. And I'll just use two examples in particular. The permitting system that I told you the Supreme Court overturned in New York, and Brady background checks. Those two combinations of laws in states that have robust permitting systems and expanded Brady background checks, they have materially less gun violence than in states that don't have that. So the solutions are right before us, and I think all of us who are looking at this and looking at the courts understand we have a tension between what voters are saying in the ballot box and who they're electing and the folks that are permanently appointed on the Supreme Court.
And they still have sporting, and they still have hunting,
Right.
and they still have collecting of firearms.
Right. So questions, I'm going to ask some questions from the audience, which are really good. How do we deal with this in a nonpartisan way? It becomes weirdly associated, like climate change, with guns. Guns are a Democratic issue. Gun control. Climate change is a Democratic issue. These are not really inherently partisan things. So
they're not.
How do we get a bipartisan dialogue and bipartisan action on this?
Well, I think we have to recognize that there are a variety of solutions to prevent gun violence. And the fact that we got the bipartisan Safer Communities Act through Congress in a world where, because of the cloture rules in the Senate, we've seen evidence over the last year how many bills actually can get through the United States Senate when you need 60 votes. And yet the Bipartisan Safer Communities Act was able to garner 12 Republicans. And that really is a sea change. I was just talking to Dr. Serrani before we came. While I view, I'll be honest, the Bipartisan Safer Communities Act as incremental change, I would really have loved to see closure of the Brady loopholes that exist where guns can be sold at gun shows and over the internet by private sellers with no background check at all, and 1 in 5 guns is sold that way today. We couldn't get the number of Democrats and Republicans to vote yes on that, to include that in the bill. So it's really incremental change, step by step by step. One of the areas that's equally important, quite frankly, and I think more important than even policy change, is the enforcement piece, right? Because we know that the ATF, on average, of these more than 80,000 gun dealers that we have in this country, they have the support and the staff to inspect 1 every 7 years. 1 every 7 years. And so where we can get more support, both from Republicans and Democrats, is let's fund the ATF. Let's fund actual enforcement. Because most gun dealers in this country, of that 80,000, by the way, don't have a single crime gun associated with any sales that they conduct. But a handful have hundreds. So those are the things we need to focus on.
And can I ask, how many guns used in gun incidents are purchased legally versus illegally? Do we know that?
We don't have any sense of that because there is no registry.
And how about the idea of gun insurance? I want to own a gun. I need to take out insurance in case something bad happens with that weapon. Any thoughts from our panelists?
Super interesting. I love it. For those of you who have homes, we think that there should be requirements to insure risk associated with having a firearm in the home. Right now, for any insurance policy that you get in your home, I'm sure you've looked at the list of questions about whether you have a pool, all sorts of questions. Typically, they're not asking questions about firearms because they disclaim liability. We need to rethink that, and that will take a lot of work because it really involves 50 different state insurance commissions across the country.
And now, with the new Congress, do you see hope there, or like,
I see hope in the Senate.
Didn't quite go as expected, but
No, I think it's going to be tough in the House, but I do think that there's opportunity for the Senate to be a first actor on things that we know are really important, like Brady background checks. We will be continuing to push very hard to get that law expanded. I was just with about 60 physicians yesterday meeting with members of the United States Senate to ask that the assault weapons ban be passed in the lame duck session. I'm sure you all have seen that President Biden is asking for that. It's a tough slog for a variety of reasons, but we will keep on pushing. one thing that I think is quite important is also executive action. There's a huge amount that President Biden can continue to do to address this, including being very clear through DOJ about what it means to be in the business of selling firearms in this country. That's a very vague standard right now. If we can define that, it will go a long way to address some of the problems because Congress has not acted to expand the Brady Law.
Okay. And Babak, seeing these patients, what's the one thing that would make a difference for you?
The one thing that would make the difference for me is to not see these patients.
Okay, well, I mean, yes, but, yes, I mean, I think we're agreed on that. You know, is there a common denominator that you think we could address that would at least reduce the change the
I think
trajectory?
the common denominator still is that the gun that I own or the gun that my family member owned that was used to harm him or herself, like an attempted suicide, that it's not the gun. Believe it or not, that the patients still believe that it's not the fact that I owned a gun that resulted in this thing in the first place. Even if someone harmed themselves, I'm thinking back to a patient I had who the family knew was becoming quite mentally unstable, and the family had multiple assault weapons as well as sporting rifles in their home, and he took one of the assault weapons, killed his mother, nearly shot his sister. His sister survived, was my patient, turned around and shot himself, so he himself died too. At no point in time did the sister or the brother-in-law, her husband, say, gee, if we just didn't have all these guns, or if we had used an airpole law to get rid of these guns, this wouldn't have happened. So if I could change one thing, it's this concept of guns don't kill people. You guys, guns are not designed to hurt you. Bullets and guns are designed to kill you. That's the whole concept.
And George, is anything you want to add to that about if there's? I know the solution has to be multi-dimensional, but
you know, clearly, I think we have to be more visible about not just the deaths but the injuries. Mm-hmm. We get shocked when someone tragically goes in and commits a mass shooting, but you know the vast majority of these are one-offs. Obviously, someone who's committing suicide. Or someone who's injured with a firearm. And I think transparency and more coverage of that so that this becomes an issue, and it has to be coupled in the media with the solutions. So far too often we talk about the problem, and then the solution is either mental health or thoughts and prayers, neither one's for a solution. But we need to come back with concrete multi-sectorial solutions on why that might help.
And can any of you reflect a little bit on the what seems to be a uniquely American obsession with guns and having assault weapons in your home? Why do
we celebrate it? RoboCop 1 had lots of shootings. RoboCop 2 had more. RoboCop 3 had more. Transformers, each one's more violent than the next. We celebrate violence as a society. I don't want to beat on the movie industry because I love those things, but they've got to be put in context, and we don't often put those things in context, and we have to do that. But as a society, we have to recognize the framework in which we put, and then put in place policies that recognize that there are challenges. But at the end of the day, it's all about the guns. If we could dramatically reduce the number of guns in our country, we would, just like any other injury, we would dramatically see a reduction in firearm-related injuries.
I also think there's something to collective versus individual rights in this country, and I think about that on a number of issues, including firearms. There's this notion that frankly, the National Rifle Association has sold that having a firearm is a risk-free value proposition. And that really was something sold not really before the 1970s. When you look at the National Rifle Association, it was founded as a gun safety organization. But Dr. Benjamin is right, it was shifted because they have a product to sell, and they want to sell as many of those products as possible, but we all pay the price for that. And I think one takeaway that I feel pretty constantly is we do live in a society where we benefit ourselves by looking out for each other. We're lying to ourselves if we believe that's not the case. And I think a big part of this is understanding that in dealing with and tackling with this issue, we have to have conversations with each other about the role of firearms in our society and what changes we want to make. A lot of it, in the end, is actually on us to change how we think about this and to change our relationship with firearms. I think Hollywood has a piece of this, but certainly how we parent and how we talk to our friends and neighbors makes a huge difference as well.
And I think increasingly, one of the questioners was asking, and we have to wrap up sadly because we could go on forever about this, but we have work to do to make it happen, is the role of social media, TikTok, to kind of, we deal with this in journalism. How do you reach that next generation who can so influence policy? Are there any social media influencers who are big on no guns? I mean, I know there are a lot of Wild West social media people.
One of our favorites at Brady is Steve Kerr, coach of the Golden State Warriors. He lost his father in an assassination. He is incredibly vocal. For those of you who saw after Uvalde, he gave a press conference, and it was incredibly moving. We need more influencers like that. I don't know if you saw over the weekend, some football players were wearing end gun violence over their cleats. We're in discussion with Major League Baseball. We want to see a lot more in sports stadiums, content that's directed at all of the fans, focused on ending family fire, on safe storage. If we're going to change this, the role of corporations and other influencers cannot be understated. It's really, really important.
Right. So it's changing the norms around gun ownership as much as policy change. It's both. All right, well, thank you, everyone. I'm sorry we can't talk longer, but there's work to do.
Thank you for joining this discussion. Please join us for the lunch plenary taking place in the Grand Ballroom at 12 p.m. We gratefully acknowledge the participation of the following organizations whose generous support makes this summit possible. We thank the Milken Institute strategic partners for their year-round support of our work around the world.